Hi, this is Dr. Lori Byron again with Climate and Health Advocacy Part 2. This is part of the Climate Change and Human Health in Montana training series. So I'll now share my slides now that you know I'm a real human being. So we're continuing on from where we left off last time, looking at sections 2, 3, and 4. So now we're going to look at ways we can work within Montana climate and health groups, of which there's only one at this point, and Montana environmental organizations and local environmental organizations. So the Montana Health Professionals for Healthy Climate began about 2 years ago. We have about 170 people so far. And these are some of the actions that we've done to date. And we're always open to new ideas. We'd love to hear from other people as to other things that we could be doing. We've provided testimony to a number of groups, both with the EPA and in the state government groups, and when Northwest Energy has had hearings, et cetera. We've been doing op-eds about twice a year, trying to get them in papers in all the major cities in Montana. And we've worked with some of the municipalities as they've created climate action plans. We've also done some education in legislature this past legislative session. We have a social media presence, and we're on YouTube and Facebook and Instagram and Twitter, and we have a website, montanahphc.org. We also helped write the C2H2 report, the Climate Change and Human Health report that came out earlier this year, and we'll talk about that later. 3 of the 7 main authors were board members of Montana HPHC. And we worked with the Department of Public Health and Human Services and local health departments on several issues. Many of the members have also done a lot of presentations to churches and medical groups, community groups, and climate and environmental groups. So here's your climate action of the day. Whip out your phone or get on another tab on your computer, on your browser, and go to montanahphc.org and just sign up for our newsletter. Your name is kept confidential, but every additional sign-on strengthens our voice in Montana, so it helps. Basically, we want to do anything we can to further action on climate in our state. So within our Montana environmental and climate organizations continue to be the same concerned citizen that you already have been. And most of us have gained a lot of strength and camaraderie and developed friendships through these groups. But you can also speak up as a health field person. And so there's a number of health field ideas that you can do within these groups. For example, Moms Clean Air Force, they have about 2,500 members in Montana, and they recently started a campaign to advocate for electric school buses. And they worked with the Montana Health Professionals for Healthy Climate to develop talking points about the health harms of diesel buses when they did a diesel school bus and electric school bus event. The MEIC, or Montana Environmental Information Center, has been concerned about the health problems of gas. Notice we don't call it natural gas. And in September, we're doing a road show between MEIC and the Montana Health Professionals for Healthy Climate, just educating in the major cities around Montana about the health effects, the harmful health effects of natural gas, both in our homes and in fracking operations. The faith groups have been active too, and we have local faith groups taking action on climate. The Montana Faith, Science, and Climate Action Group began in 2018. We had a live conference then, and then a virtual conference in 2020. And out of these 2 conferences and the actions of the doctors, the scientists, and the faith leaders that were in these groups, they formed a Montana chapter of Interfaith Power and Light. IPL is a national group that works on energy efficiency and installing solar in faith communities, and also teaching the members to be activists on climate action. So within local environmental and climate organizations, you can also continue to be a concerned citizen, but you can also speak up as a health field person and help your organization consider health as they advocate. So for example, the Bitterroot Climate Action Group was just started about a year ago. And one of the founding members is a naturopath and acupuncturist. And when they did their white paper to present to their city and county, they included the health effects, which that naturopath helped to write. The city of the city of Missoula has a conservation and climate action plan, and they have incorporated health. And again, they used local health officials to help them. Both the SKC and the Blackfeet tribes have climate adaptation plans that also have health included in them. And we were able to visit with them in some of their planning sessions. Climate Smart Missoula has done a lot of actions that have incorporated human health into climate change. Maybe most recently was the Wildfire Smoke Week that they did just last month. That would be July of 2021. And a lot of the emphasis during that week was on human health effects. And again, they used local experts on wildfire smoke and health in their planning. So as healthcare professionals, we can advocate in other ways. So we're looking at number 3 now, and this applies largely to our academicians and students about adding climate change to the curriculum and doing research. So as far as I know in Montana, these various groups have actually incorporated some climate change and health into their courses. We talked on the first lecture about how MSU School of Nursing signed on to the nursing school commitment with the Alliance of Nurses for a Healthy Environment. So the commitment implies that they're going to start working to incorporate climate change. Dr. David Gilkey at Montana Tech in Environmental and Occupational Health has incorporated climate change into some of his classes. Dr. Haley Blackburn at the School of Pharmacy has done likewise. And within the Montana Family Practice Residency, Dr. Jennifer Rabome has also incorporated climate change. The WAMI program, which is the Montana medical students that are at the University of Washington for medical school, have had climate change lectures the last 2 years, and they're starting a planetary health course in 2022. And the Carroll College nursing program has had some climate in their curriculum. And the MedStart program, which is our health students that are in high school and planning on going into health careers, incorporated climate change this summer of 2021. And then, of course, the University of Montana Climate Studies minor offered their first course in climate change and human health in the spring of 2021. What I've been told by academician friends is that when students request education on climate, that's the most effective route to actually getting climate into the curriculum. So students out there, you have a lot of power. There's also been some climate research that's been done in Montana. Probably the biggest body of research was the Climate Change and Human Health Report, which was released in January of 2021. 3 of our board members with the Montana Health Professionals for Healthy Climate worked on this. It was also worked on by the CARE Center at MSU and the Institute on Ecosystems. But it involved a number of scientists and researchers and healthcare providers all across Montana, and it's available at montanaclimate.org. Also, we're looking for places to present the findings of this work, and a large part of this report was to talk about what local actions can happen, what we can do to adapt and mitigate climate within our communities. So if you have an idea of someone that might like to hear a talk, please let us know and we will find someone to do the talk. There's been some smaller research projects done, but very important. One was done by a grad student in public health at MSU, Meredith Howard, along with Selena Ahmed, Dr. Paul LaChapelle, and Mark Schuer. And they did a survey of farmers and ranchers and looking at mental health concerns related to climate change, and actually found significant concern amongst this group of people. Sally Moyse, who's a nursing instructor at MSU, and Emily Healy did research on heat-related illnesses in occupational settings about 2 years ago. And I did a survey of environmental health and public health professionals in Montana about 2 years ago and found significant concern about climate change in this group. So hopefully more students and researchers across Montana will continue to do research on climate change and human health topics. Sarah Lorch is one of the board members for the Montana Health Professionals for Healthy Climate, and she introduced climate discussions and education into the Honor Society of Nursing at MSU in the past year or two. And pharmacy students at the University of Montana are starting to work with Dr. Blackburn on climate issues. So as healthcare providers, we can also advocate on climate in the things mentioned here in group number 4 by working on our own on actions that decrease emissions and actually avoid the words climate change, and just working by our own in general. So the first category, working on issues where we might not even use the word climate change, which sometimes is important in some of our cities and towns. One of those is looking at the transportation sector. So there's the average the average American who makes a switch to public transportation actually loses 12 pounds in the first year just from the little bit of extra walking that they do. You might have a passion whose end result is a decrease in greenhouse gas emissions. And these are the kind of things that we're talking about in the next couple of slides. So when we work on local efforts to improve walkability and bikeability and improve our public transit systems, we're working to decrease greenhouse gases, even if climate change is not mentioned. And not only that, but these actions also improve human health. So these are just a couple examples across Montana. On the Missoula City County website, it talks about Walk Missoula. In Bozeman in 2020, they did the redesigned Streamline 2020, looking to improve their transit system. There's a Billings traffic study that's ongoing, again, looking at ways we can improve the downtown to make it more bikeable and walkable. Bike Walk Montana works on these issues all across Montana. And then there's Safe Streets programs. So a number of communities have gotten safe streets policies or safe routes to school policies, and they do the same thing. They by making our regions safer to walk and to bike, we find that more people do walk and bike, and this helps clean up the atmosphere, and it also helps human health. A lot of us are passionate about local foods, and that's another area where we can address climate change without necessarily even saying the word climate change. So as we work on and support the CSAs, the community supported agriculture products and food hubs and farmers markets, we're helping decrease emissions, and we're improving human health. There's good research showing that farmers markets and CSAs increase a sense of community, which improves our mental health and our physical health. And when we use these local sources, we look our farmer in the eye, we actually make better food choices, and we eat more fruits and vegetables. We also improve our local economy and support small farmers, which is also better for our land and for our economy, which also improves human health. There are now actually over 50 farmers markets registered in the state of Montana, which is pretty amazing. And there's a lot of local food hubs, such as the Yellowstone Valley Food Hub and the Western Sustainability group in Livingston. Of course, there's a Montana Organic Association and a lot of local CSAs. The logo there is from Helena, but they're all over. We even have a tiny CSA in Hardin, Montana, where I live. Those of us who work to protect wild lands and appreciate our forests and grow trees are also helping decrease emissions or increasing carbon sinks, or the absorption of carbon from our atmosphere. Again, there's a lot of medical research showing the positive mental health and physical health benefits from having more tree cover, especially in our cities and towns. So many of you have probably already heard of heat island effects, but heat islands are the areas where regions of our cities and towns that are hotter because there's less tree cover, and they tend to occur in poorer areas of our communities. And so as we improve the tree cover, we actually improve human health because people get out more, they walk more, they are happier in their environment. And we also help absorb pollution and absorb CO2. Project Drawdown, which many of you have probably heard of, they're at drawdown.org. They have looked at the most effective 100 actions that we can do in the world and what the costs are for those actions. And basically everything that's done to lower emissions and decrease air pollution improves human health. So when we look at sustainable agriculture, it's healthier for people, it's healthier for the planet, it decreases emissions. When we transit to renewable energy, we are decreasing air pollution, decreasing the CO2 in our atmosphere, or helping not add more CO2 to our atmosphere. When we improve bikeability and walkability in public transport, the same thing. And when we plant trees, the same thing. But there's a number of things that drawdown.org discovered that we don't necessarily normally think of in relation to climate change. So if you look at number 6 and 7, educating girls, which applies mostly to countries where women and girls have less opportunity to get educated, and family planning actually have huge benefits for the climate. And then the last category is on our own. Some of us live in rural areas, some of us are remote, some of us don't like groups of people, we're introverted, and there are lots of things we can do on our own. The first two I say require 0 minutes because they should be what we're all doing, and that is to vote in every election. And we all know there's a lot of people that don't vote, and sadly there's even more environmental people who don't vote. They're actually some of the worst groups about voting. So we should be voting in every election. We should be talking about climate. Dr. Katharine Hayhoe, who's a famous climate scientist and public speaker, says that talking to our family and friends as colleagues might actually be the most important thing that we can do for our climate. We can also write letters to the editor and op-eds, and we can call or write our elected officials, both in Montana and in our members of Congress. And you don't necessarily have to research all the bills that are going on right now. If somebody tells you about them, that's great, but just sending an email to a member of Congress telling him, we want to see real action on climate change, we care in Montana, just doing that to all 3 of our Congress people once a month is a great thing to do. They actually keep track, literally week by week, in the office of the people that call pro and con the various issues. So it's important. We can lobby our legislators. Oops, sorry. Notice that I did not mention changing our light bulbs, recycling, and driving Priuses. And these are all good things to do. It's good to walk the walk and walk the talk. But these are not going to really help the climate crisis. We need collective action. So I'm just going to show you a few more actions that you can do as an individual. You can lobby Congress, both as an individual or with one of your local groups. And over this past year or two, we're now able to do so virtually. So it doesn't always require a trip to Helena or to Washington. And these are just some examples, both within and without of Montana, of things that people have done. Colleagues of mine in California did an interview on Instagram with the National Resource Defense Council on fracking, and then she kind of became the health fracking guru in in California. And a colleague of mine in New York is a pediatrician, and he's also a big tweeter, so we call him our climate tweetiatrician, and he leads a whole group of pediatricians that tweet on climate issues. Again, we can do op-eds and letters to the editor on climate and health. And that's done reasonably frequently in Montana. If you like public speaking, or if you want to get better at public speaking, think about public speaking venues. So several of our cities and towns have TEDx talks in Montana. And at least Bozeman twice a year has a Pachacacha night. And these are great ways to get the word out on climate and health issues. And they also actually help coach you to be a better public speaker, which is actually really helpful. If you are a member of an organization, especially of a service organization, you are what we call a trusted messenger. You're in that group, you're known by that group, and you can talk about climate change where they might not listen to it to some stranger that comes into town to give a lecture. So a lot of these groups have community projects. A lot of these groups have speakers come in. So climate's a topic that you can propose if you're already in them. Dr. Paul LaChapelle, when he was working with the Extension Office, actually created a climate change module for 4-H, and that's now a national module that 4-H kids can take. I have a friend who worked with the Girl Scouts with her daughter, and they created a local badge on climate change. I have several colleagues that have gotten involved in heat mapping projects. Again, the heat islands are a real thing in our cities, and it's a big environmental justice issue. And so these pediatricians or their climate committees have been invited to help with heat mapping projects in other states. We do not have, as far as I know, any identified cooling centers or clean indoor air centers in Montana. I know Missoula's thinking about it and looking at it, but the other cities really haven't. And with what we're seeing in regards to fire and smoke and heat in Montana recently, these are things that are needed. There's a lot of people that don't have air conditioning and that have leaky enough houses that they do not have clean indoor air. And there's a number of people who are at risk from overheating and from dirty air. So this is an idea for a project in a number of communities across Montana. So as we look back on our learning objectives, I hope that these two short lectures have been able to help you with them. I think we've explained the power that healthcare providers have. We're trusted members in our community. We're trusted voices. We can work in coalitions and with politicians and with health groups to expand education and advocacy on climate change and human health. I hope that with all the actions we've talked about, that you've seen one action that could be applicable to your place of work or to your community that can be done without additional staff or funding. And I'll also add on that could be done without time, because like we said, all of us can vote, all of us can talk about climate, and most of us have 10 minutes a month that we could write to our members of Congress. And we've talked about a lot of different potential partners in communities with whom we can ally. And when we do collaboration, we always increase the breadth of our projects. So again, if you have questions or suggestions, I would love to have you contact me. We would love to have you sign up for our newsletter. Remember, your name's kept confidential at montanahphc.org, because we want to increase the voice of healthcare providers in Montana. So I hope you've learned and benefited from this course. Thank you so much for taking the time and the energy to take this course.